Hi, welcome back to the Harpreet Singh Show, and you're watching Tania's Truth Talk. Recently, I was in Beverly Hills, Los Angeles, California, and I was interviewing multiple celebrities. I'm about to show you an interview I did with a Beverly Hills plastic surgeon by the name of Catherine Begovich. She's been featured on the TV show called The Doctors. But what I want to show in this interview is Catherine Begovich also helps human trafficking victims. She helps women that suffer from domestic violence and fixing their faces and things that have happened when they've been victims of abuse. So please enjoy the interview. Okay, welcome to the show, Catherine.
So glad to be here. Thank you for having me.
Thank you, and welcome to the show, Cyrus.
Thank you for having us.
Thank you. Catherine, the reason I wanted to have you on the show was because I'm involved in advocacy work, and I found that your story was very empowering to women. You're a Beverly Hills plastic surgeon. We're downtown Beverly Hills right now in your office, and you are in a market that is very competitive with other plastic surgeons, and you are one of the only female plastic surgeons in this area, which is extremely competitive. Can you tell me more about that and how that's been working for you?
Sure. There are definitely a lot of plastic surgeons in Beverly Hills, but what I think makes me sort of unique, in addition to just being a woman, because less than 10% of female plastic surgeons are women, is that I think that maybe being a woman, I'm definitely a lot more involved with a lot of my patients. I mean, the majority of my clients and my patients are other women. Yes. I've also had plastic surgery myself, and I think that allows me to really empathize with my patients because I understand where they're coming from.
Right.
And I think that I really try to take the time to communicate, be a good listener, because in the end, it's not about me. It's really about them and what their needs and their desires are and what they hope to accomplish for themselves.
Right.
And so, they always say women make great listeners, and I think that being a doctor, you have to be a good listener too. And in order to, give patients sort of the best experience and also the results that they hope to achieve.
And what inspired you to get into plastic surgery?
Well, the thing that I love about plastic surgery is that of all the medical fields, it's really one that sort of takes care of a person as a whole. Right. It's one that it improves people's quality of life. It's one of those fields that really helps people feel better about themselves. And by definition, plastic surgery is a field that makes people whole again.
Right.
So, a lot of times people think of Beverly Hills plastic surgery as being only superficial, cosmetic surgery, people who only care about their appearance. But that's not actually the case. There's a lot of patients who come in who have had experienced, significant traumas. I've taken care of patients who were victims of domestic violence, people who had horrible traumas, dog bites, were involved in accidents where I've been able to put things back together again so they can proceed with their life functioning normally.
Right.
Breast cancer reconstruction is also something that plastic surgeons do. And when I was at UCLA, I did a lot of surgeries on children where they had cleft lips, cleft palates, other sort of physical defects they were born with. And just to allow people to be functional and whole again, I think is something that plastic surgeons also do that maybe the media doesn't focus that much attention on.
Right. And where did you study?
I went to Harvard for college. I
Harvard.
was a molecular and cellular biology major.
Wow.
Okay.
And then I went to UCLA for medical school, as well as 2 surgical residencies. So I initially actually had a lot of training and experience in head and neck cancer and reconstructive surgery. And then I ended up going back and doing a second residency in plastic surgery.
Right.
And it's interesting sort of the path that led me here. My training and my experience in head and neck cancer reconstructive surgery really, I think, has helped shape me as a surgeon because, as you know, if you're dealing with the neck up, everything is all very, very fine, detailed work. Really, there's very little room for error because everyone sees the face.
Right.
And, personally, it's something that I stopped doing just because I tend to get very attached to my patients. I'm not the kind of doctor that can just operate on somebody and feel like, okay, I'm just, fixing one part of their body without getting involved with them emotionally and sort of going on a whole journey with them. And taking care of those cancer patients, honestly, it was too emotionally draining for me. I was I mean, these are people who really have very, very bad outcomes despite the best surgeries.
Yes.
And I realized it was just something that I could not continue to do for my entire career and not just be
traumatized, really
depressed all the time.
That makes sense.
So plastic surgery is great because, like I said, I'm still able to help people. I improve their quality of life, but at the same time, they're usually healthy people without major medical problems. It's sort of, like I said, is an improvement where I'm not really having to feel like, okay, my patient's gonna call me because they, have a horrible disease, horrible cancer where they're suffering.
So it's a bit more
they're
positive.
happy. Yes. It's always a happy experience for my patients.
And a happy outcome, yes.
Right,
and you, Cyrus Nonajad and I do business together. He is now also managing me as well in my career in the movie business, TV business. And he highly recommended you and had told me that you had been, you're a famous plastic surgeon in the aspect that you've been on a lot of TV shows. Can you talk to me about those?
Sure. Well, I've been on The Doctors TV show twice, which
The Doctors is a very popular.
Is it popular in Canada?
Very popular. In
I think my
Canada.
husband actually said he saw me in Sweden and his relatives saw me in Germany, so I guess it is international.
You're quite famous.
The first time I was on The Doctors, I performed a facial rejuvenation procedure.
Okay.
The second time, I actually did a very complex liposuction revision case. It was a woman who had liposuction in the past.
Right.
Someone left her with, a horrible result, horrible irregularities, that really almost, was traumatic for her being a young, healthy person. And so on that particular episode, I actually did a revision surgery, and that's actually one of the surgeries that I do a lot of.
Right.
People take plastic surgery for granted. There's a lot of different specialties, even people who aren't trained in plastic surgery that perform liposuction.
Right.
And people take it for granted that it's just, you go in there and suck out the fat. But it's actually an extremely technical procedure to be able to do it well. And I have a lot of special techniques that I've developed over the years to really do a good job in terms of blending and giving people a natural look where they don't look overdone or it doesn't look obvious that they've had work done.
And yes, and I'd like to comment too, because I have a lot of entertainment clients, and that's one of the ways I became acquainted with the doctor, in that, like, my clients have come to her and had such great, great things to say, great results. And, a lot of entertainers do a lot of plastic surgery as well. I know that's one portion of your business, but, she spits them up just perfectly.
Right.
And I think the thing that's important, that I always try to emphasize with patients of mine who are either actresses or in entertainment is that I always tell them, the best plastic surgery is one that looks natural, that doesn't look like you had work done. Because if you look like you've had work done, you end up looking a lot older, or people just become so focused on that work, it detracts from the actual person themselves. So for those particular patients, I do have special techniques that I use, even like before award show time. I actually did a German TV show, RTA, which is like a very, very, they're sort of entertainment focused. And one of the things that I talked about was, for these particular entertainers, you want the Botox to look natural. You want the filler not to look overdone. If people get breast augmentation, it should look natural, because otherwise it keeps them from getting roles that they might otherwise, not be able to get if they're overdone.
And you actually have many famous celebrity clients, so you're quite well known here in Beverly Hills.
Thank you. Yes, I do. But like I said, in the end, I always tell people everyone gets treated the same. Everyone gets treated like a celebrity in my office.
Yes.
But yeah, and like I said, they do, tend to want to be more discreet. A lot of times I'll have to see them on the weekends or after hours, just because, like I said, everyone has the right to their privacy, just like everyone has the right to plastic surgery.
That's right.
But it doesn't give everyone the right to know.
That's right.
And her follow-up is just spectacular. From what I've heard. She really cares for her patients. And right after surgery, she calls them and is right on it. She makes sure they're very, they're following everything she spoke of and the doctor's directions.
Right.
Yeah, because I think, like I said, it's the whole process, and it's a journey that we go through together. So it's not just like you do someone's surgery or, even an office procedure and you're like, that's it, goodbye. I've kept relationships with my patients for years, and a lot of times even become, close friends with a lot of them, just because there's something really special about that patient-doctor bond that you really, you don't find anywhere else.
Now, I've also found that you are a former fitness model. So that is quite empowering, because you went on to become not just the beauty, but you've got the brains, and now you're empowering women as well that are, being injured through domestic violence, dog bites, and things like that you've suggested. So
her husband is a very famous fitness model, world champion fighter, and professional bodybuilder, and they've done some.
Yes, I actually met him through Cyrus.
That's right. I
We
actually,
met in his
Cyrus
office.
My office. They met. They got introduced, and I went to their wedding. And good friends with their husband.
Yeah,
right.
So it's fantastic.
Cyrus is part of the family.
And you have an 8-month-old daughter. So tell me, how do you do this?
She does it all.
I'll be honest with
You're
you.
one of the top doctors in Beverly Hills. You have an 8-month-old baby. You certainly don't look like it.
Oh, thank you.
You're a superwoman.
Oh.
So how are you managing all this? What would you say to women out there that are struggling, single moms and stuff, to encourage them or empower them?
I mean, I would say that it's definitely challenging. I mean, honestly, to say that it's a piece of cake would be a lie. I mean, it's definitely challenging. Working, being a mom. I mean, it really is a full-time job. It's not a cliche.
Yes.
I think in the end, what matters most is just having a positive attitude. I mean, even when I was pregnant, I mean, I literally operated until about 6 days before I delivered.
Oh,
right.
And I loved every single moment of my pregnancy, honestly. And I loved every single moment of like having a newborn.
Right.
Because in the end, it's like this is life. And you can either choose to complain about it, or you can embrace it and really enjoy every aspect of it. And so, it's definitely challenging to juggle everything. I mean, I happen to have a fabulous husband who also is very supportive. But I think having balance in life is always very important.
Right.
And I would just also tell women, just if you need help, don't be afraid to ask for help. And I think there's a lot of people who would be willing to, provide support, for if they needed it.
So I think, the public can tend to think, plastic surgery, that it's all about vanity and looking nice and so on. But there's just so much more to that than being a plastic surgeon, where there's a lot of other stuff that's involved. I mean, injuries and so on.
Right. I mean, but not only injuries, but for example, I mean, the majority of the procedures that I do are mommy makeovers, which are, pretty much, breast augmentation or lift with an abdominoplasty, and also sometimes labiaplasty, which is vaginal cosmetic surgery. And I mean, I have even young mothers who are in their 20s, but I mean, let's be honest, after you have a baby, it changes your body. I mean, I came out of it, and I, still have, I look different. I mean, that's just how it is.
Right.
And I think because I'm a mom, I have a lot of moms as my patients, and, being able to sort of regain their pre-pregnancy state.
Right.
I mean, that's not superficial. That's sort of, kind of going back and being good to yourself. I mean, being a mother, I think, should be rewarded. Yeah. But women, mothers also need to be able to take care of themselves.
Of course, your husband's a professional bodybuilder, and
that gives me a lot of pressure.
And you have one of the best trainers in the world keeping you in shape as well.
Right, but like I said, I mean, there's some things, even with like hard work. I mean, you just need to turn to surgery. There's just there's
no way around
nothing you can do about it, and it's not because women aren't working hard enough. Sometimes afterwards, you just have that little extra. I mean, you get weird pockets of fat when you're pregnant. I mean, it happened to me. It happens to all of us. Right. And sometimes you do need to have surgery just to sort of bring your body back to what it was before.
Right.
And like I said, in terms of trauma, I mean, I do still take call in the emergency department. And when I was at UCLA, I mean, I definitely took care of a lot of patients who either had trauma.
Right.
One of the UCLA hospitals I worked out of was a county hospital.
Okay.
And I know that you are involved with a lot of charities that focus on domestic violence. I mean, I definitely had a lot of patients who were victims of domestic violence. The most common injuries being either a broken jaw or a broken nose. I mean, especially the nose for some reason. That is just one of the most common injuries.
My nose was broken through domestic violence too.
Oh, I'm sorry to hear that. I mean, it definitely is very common.
It's common, yes.
And I think as a physician, one of the take-home messages that I always, sort of tell my patients is like, I'm only one part of the solution.
Right.
It's not just you can get something fixed and then, like I said, you just go on with your life. I mean, there's a whole, emotional, physical, the things that people go through when they are victims
and
of
you have
domestic
a whole
violence.
team,
Yes,
right?
you were
have a whole
mentioning
team.
to me earlier that you have a whole team that you work with,
Exactly.
because there's so much more to it than just the reconstructive.
Right, and so
part.
I never think that, okay, I can just go and fix someone's nose or fix someone's jaw and walk away.
Right.
You know, I always try to make an effort to, you know, if someone has a social worker, if someone has a counselor or a psychiatrist or, you know, a sponsor that is taking care of them, I feel like as a doctor taking care of that whole person, it's really critical for me to communicate with them. And sometimes, especially if there's, you know, some sort of substance abuse involved, you know, I do have to involve that person's family, their sponsor, because otherwise, if I especially if I do a repair where I'm you know, using sutures, you know, that are as fine as, you know, a hair, almost like I have all these tiny little sutures in place. I need to make sure that there's someone there helping that person through the recovery phase, making sure they take care of their surgery site. Otherwise, the whole thing's going to fall apart, or they're going to get a recurrence. I mean, if it's somebody that's a victim of domestic violence, I want to make sure they have a support network, because if they go back to that person that injures them, they're going to get their nose broken again. You know, so like I said, I mean, it's one of those things where as a physician, you can't just, you know, you can't just focus on that part of their body. Like, you have to focus on the whole person and really work to sort of get them better in every aspect of their life.
Well, you are an absolutely amazing woman. You're not only beautiful on the outside, but you're beautiful on the inside as well. I really commend you for the work that you're doing, and it's been such a blessing to have you on my show. Thank you very much. Thank you, Cyrus.
Thank you for having us.